In the early months of the pandemic, Dr. Paula Clayman cared for COVID-19 patients in a Toronto emergency department. Months later, she's on maternity leave with her third child. Now Clayman says her hospital won't let her get the coronavirus vaccine simply because she's breastfeeding.
It's been quite disappointing, to say the least.
Ontario's Ministry of Health recommends anyone pregnant or breastfeeding should not receive either of the two approved vaccines. That's because there's a lack of data, since pregnant women weren't included in clinical trials.
But what it does is it takes choice away from women.
They should be at the front of the line unless we have really strong evidence that there's a reason they ought not to be.
A growing chorus of experts is calling for a policy change.
I think that the Chief Medical Officer of Health really needs to take advice from the specialists that are practicing in the area.
Federal guidance is to provide the shot based on the level of risk and informed consent, but there's a patchwork of policies among the provinces. While Ontario and Quebec both discourage pregnant women from taking this vaccine, officials in BC stress the risks of getting infected with this virus may outweigh the potential risks of getting the shot. New Canadian research backs that up. Hospital data from March to September showed pregnancy does increase someone's odds of falling seriously ill with COVID-19.
Pregnant women do have higher rates of hospitalization.
Ontario officials told CBC News they're reviewing the layest evidence and will update advice, but not quite yet.
These options are absolutely not acceptable.
Clayman hopes the guidance changes soon, before she's back on the front line. Lauren Pelly, CBC News, Toronto.